Assignment: not what the doctor ordered. Question 1. You are a nurse in a hospital who is preparing to assist in the operating room. You observe the primary surgeon scrubbing for the surgery, and just before he enters the operating room, he stops to sign some papers. How would you approach the situation? I would say, Dr. Avery, I noticed you signed some papers without a sanitized pen. I think you should re-scrub in for the surgery to prevent from taking bacteria that may be harmful to the patient into the operating room. Question 2. You work for a tyrant of a doctor who has fired several nurses in your department. You just saw him make an error that may endanger the patient, but you are afraid to speak up. You need the job. What would you do? Depending on the situation, I would do one of two things. First, if it was during surgery, I would be obligated to say something right then and there so that he could fix the error. If it wasn't in surgery, I would go to the chief of surgery and let him know what the doctor did. I would explain why I was uncomfortable confronting the doctor since he was firing so many nurses recently in that department. Question 3. You are a doctor in a reputable hospital and work with a physician who you regard as incompetent in many areas. Do you speak to the doctor directly or opt to speak to your boss? What are the advantages and disadvantages of each approach? I would speak to his boss since I don't really have the power over this physician. The advantages of this would be I'm not going to hurt this physician's feelings by saying he's incompetent or trying to show to him that he's incompetent in these specific areas. The other advantage would be if his boss did find that he is incompetent in these areas, potentially letting this person go. The disadvantage would be he could see me as a backstabber, and that I didn't try to have him fix the problems that I saw and went over his head. And that's it.